Hi, I'm Dr. Carlton Pereira, a practicing ENT physician and surgeon from Mumbai since the last 17 years. I have a keen interest in vertigo and I've done a lot of international speaking on the same topic, presented a lot of papers and also done a lot of studies in this. I like vertigo because it has a lot of different diagnoses to it, and if you get the right diagnosis, your treatment is spot on. So today we'll talk a little bit about vertigo in a really short snapshot. There are two main types of vertigo. It either arises from your ear or it either arises from the brain. 99% is most of the time is from the ear, and that's where the ENT doctor is the one who's probably the best to diagnose your case. The 1% arises from the brain. That's what we call the central area, and the rest is peripheral. Peripheral is the part of the ear. Now the inner ear has various different structures. It has semicircular canals, it has nerves, it has fluid flowing, it has a little tube which goes to the brain. Each and every different part of it leads to a different diagnosis. The most commonest one is the benign paroxysmal positional vertigo, also known as Bppv. This is the most commonest variant of vertigo. This lasts for a few seconds, especially on getting up from bed. The person gives a history, oh, I'm feeling dizzy. Now what do you actually mean by the word dizzy? It's a sense of that other things around you are spinning or your head is spinning. Dizziness can also be understood as headaches. The giddiness can also be attributed as shakiness in the legs. That's postural vertigo. There are a lot of different types of vertigo. This is a test which we do these days to identify a type of vertigo. It is called a VNG, which is a video nystagmography test. It's been around for quite some time, but it really helps you and the doctor to understand your case better. Now, the second most commonest type of vertigo other than positional vertigo is vestibular migraine, which is a vertigo accompanying by headache. A lot of people have headaches and vertigo and headache, one of the two, and thus it complicates matters. It's a different diagnosis, it requires different line of treatment, but you can get completely cured once the line of management is in the right direction. The third most commonest type of vertigo we have is a variant called vestibular neuronitis. This is one where people have for a long time. It's been there for a month, it's there for a few days. Once well diagnosed, that too is completely curable. Now let's talk a little bit of the brain part, the 1% to 5% of the vertigo which arises from the CNS. Now these are vertigos where people might have even paralysis, might have a drop attack, sudden blackout, syncopal attack. In this case, a CT scan would identify the problem and you would be immediately moved to an ICU and management would be started at once. Now, management of the peripheral vertigo, which accounts for 95 to 99% of the cases, is vestibular suppressants. Now, patient coming to you feeling really dizzy just wants to feel better. Regardless of what I tell him, I'm going to do some exercises for you or I'm going to do this sort of stuff for you, he wants to feel better. There are very few medications available for vertigo. It's on our fingertips. We have cinnarizine, we have beta-estine, and these are the two most popular ones. Medication given at the right time for a short duration gets everybody better. But the idea is to get the right diagnosis so we can treat you right. So vertigo, I think the most important thing is to be able to make sure your doctor, your clinician, be it a physician, be it an ENT, be it a neuro, to get your diagnosis right, explain to you why it's happening and ensure that you follow up with him for anything which might be required, rehabilitation exercises, cognitive therapy or other modalities. Thank you.